Hello everyone. Greetings from Narayana Health on the occasion of World Asthma Day on May 3rd. We have an interactive session with Dr. Ishan Capoor. Hello, sir.
Hi.
Associate Consultant Pulmonologist. So, directly to the talk. So, today on the occasion of World Asthma Day, idea about the bronchial asthma. What is bronchial asthma, sir?
Thanks for the introduction, Dr. Harshit. Bronchial asthma is a heterogeneous disease. The word heterogeneous means it has different root causes, and it's characterized by inflammation of the airways. And generally, it's a chronic inflammation of the airways. And it is characterized by a wide variety of symptoms such as chest tightness, cough, wheezing, heaviness of the chest, and it's associated with variable expiratory airflow limitation. So, yeah.
How often we see the cases, sir? What is the incidence of this case?
So, the data that's out there, as per the latest data that we have come across, the overall incidence so far is it's affected about 300 million people worldwide. And the number of deaths so far recorded as per the WHO, that's the latest recording as per the year 2019, is around 461,000 deaths. And so it's quite prevalent, and knowing when to suspect bronchial asthma and taking the necessary interventions when it comes to the management and the necessary precautionary measures is the need of the hour.
Okay. What is this World Asthma Day? Is there any theme regarding that?
So, World Asthma Day is celebrated on the 3rd of May. That's when it's being celebrated this year. And it's an initiative by the Global Initiative for Asthma. And the theme for this year is closing gaps in asthma care. So, there can be inequality when it comes to the diagnosis and treatment between the different patients belonging to the different socioeconomic strata, people belonging to different ethnicities, and, the rich versus the poor. And also there can be gaps when it comes to the communication at the primary healthcare level, secondary and tertiary healthcare level. There can be gaps when it comes to prescribing the inhaler and actual adherence to the inhaler by the patient. And there can be gaps when it comes to the scientific evidence that is actually out there and actually in terms of what is being prescribed. So these are some of the gaps that we're looking to bridge. And so May month is the Asthma Awareness Month, which is dedicated not only to the preventive aspects, but also regarding general overall awareness when it comes to bronchial asthma, and different respiratory bodies and different respiratory communities, both locally and globally, generally come together to create more awareness with regards to bronchial asthma.
Okay. How can one take part on this occasion?
So one can participate in World Asthma Day. You can inform your local council, your local governing body to create awareness regarding this. You can participate in sponsored walks or marathons to create awareness, and you can also set up a smoking cessation, quit smoking initiative at work, at your workspace, because as we all know, smoking is one of the very important triggers for bronchial asthma. So some of these measures, one at an individual level and then also at a collective level, will go a long way.
Okay. Coming to risk factors, how did you quote about the risk factors?
So risk factors, I'm sure you are aware of them as well, Harshit. One of the most common risk factors is familial. So, the familial predisposition, if it runs in your family, there's a 3 to 6 fold greater chance of you landing up with bronchial asthma. Then exposure to certain other triggering agents. Cigarette smoke we all know it's injurious to health, injurious to lung health, and it irritates the lining of the airways, and it can cause mucus buildup in the airways. And so this is cigarette smoking. There's also an entity known as second-hand smoking, wherein someone who ends up inhaling the smoke exhaled by others, and there's an entity known as third-hand smoke, wherein residual nicotine or other chemicals get deposited on the furniture, clothes, and tables, and then someone who comes in contact with this ends up absorbing them or inhaling some of these residual particles. And it's, smoking has been a culprit which is responsible for flare-ups for asthma, and we all know that it's responsible for worsening asthma control. So that's a very important risk factor. Some of the other important risk factors would be occupational exposure. So, wherein people are exposed to various metals, they could be exposed to chromium, nickel, various chemicals such as petroleum, then ammonia, sulfur dioxide. All these can cause occupational asthma. And even, healthcare professionals, we use latex gloves, and when we breathe in the protein which is lining the inner layer of these gloves, that can trigger asthma-like symptoms, and it's been reported in almost 5% of the healthcare professionals. Then veterinary professionals who deal with lab animals, or who deal with animals, or some lab workers who deal with animals for experimental purposes, can develop an allergic response to various animal proteins and to the proteins found in their saliva or urine. And some of the other triggers could be dust mites, it could be cockroaches found in the crevices of the house. And so it's very important that one not only treats it, but one also is aware of the various triggers. In Bangalore, pollen is another very big trigger. Then some people, say in the baking industry, can be exposed to flour, which can trigger symptoms of asthma. So, the list is almost endless. So I think one is to address and find out what is the risk factor in your case, and then to take the appropriate measure.
Okay. Coming to after knowing this risk factors, coming to the symptoms as well as clinical features. When should one suspect the bronchial asthma? When should the patient come to the hospital?
So coming to the first part of the question, when a patient is having episodic history of cough, wheezing, chest tightness, breathing difficulty, generally triggered by, could it be seasonal variation, it could be triggered by some of the other triggers like I mentioned before. And so these are some of the symptoms that they may present it. They may also present with some symptoms of allergic rhinitis, which is symptoms of the upper respiratory tract, wherein the patient presents with sneezing, running nose, and nasal stuffiness. So this constellation of symptoms as well can go hand in hand with asthma. So generally, these are the symptoms that we generally come across. Coming to the second part of the question, the red flag signs as to when a patient with asthma should come to the hospital would be when an asthmatic is, say, finding it very difficult to talk, finding it very difficult to finish a sentence, gets breathless on walking a short distance, or when he feels that his reliever medications, they are generally on medications, these patients are on medications to relieve their symptoms. When they notice that their reliever medications are not helping, where the oxygen levels are dropping, and also if they have any bluish discoloration of the skin, of the nails, or if there's an increase in the heart rate, and if their regular go-to treatment options are not working and they have this subset of symptoms, I think they should definitely visit the nearest hospital for further care.
Okay. So, what about the diagnosis? Coming to a diagnosis, how do you diagnose this particular condition?
So, so asthma, like I mentioned initially, it's a heterogeneous disease. So it has different root causes and triggers. So when it comes to diagnosing it, one, clinical history, nothing can replace a good clinical history. So we should take good clinical history, hear our patients out, and actually see if they clinically belong to that subset when it comes to the diagnosis or not. And then we can do a pulmonary function test or a spirometry, which is a method used to assess airflow limitation, in which the patient actually blows into a machine, and if there's any limitation in the airflow, that gets detected. And we can also do it with a test known as bronchodilator reversibility. So bronchodilators are medicines that are used to dilate the airways, the narrow airways. So we give these medicines in this test to see a good response. And generally asthmatics have a good response to bronchodilators. So we can do this, the spirometry. In some settings, we can also do a test known as FeNO, fractional exhalation of nitric oxide, to look for, this is detected in the breath. And this basically gives us more insight regarding the airway inflammation, eosinophilic inflammation in the airways. So if there's a higher cutoff value, you can it can guide us towards the line of management whether the patient will respond to inhaled corticosteroids or not. Along with this, generally we also get a X-ray done as a part of routine practice. Because we have some other asthma mimickers, some other conditions with mimic asthma, to rule out other conditions so that we are not missing out on anything else. So these are some of the important tests that we do in our OPD practice to diagnose asthma.
Okay. What about the recently with the 2020 we have got the pandemic, it's COVID-19. Since then, even the GINA guidelines started saying about the association with COVID-19, asthma with COVID-19.
Yeah.
And what's your take on that, sir?
I think that's a very, very relevant question because, a lot of people, I think even our loved ones who have suffered from asthma and COVID have this question. So I think one, asthma alone does not increase the risk for COVID-19 and does not increase the severity for COVID-19 infection. And it also is not associated with a worsened or increased mortality with COVID-19 infection. The patients who are asthmatic and who end up testing positive for COVID-19, they should continue their mainstay of treatment. Generally, they are on bronchodilators along with a combination of inhaled corticosteroids. So they should not stop those medications. They should continue those medications, which will help in establishing good asthma control. And they should also get vaccinated. So, asthmatics are, viral infections in general are a trigger for an asthma flare-up. So these patients should definitely get vaccinated, not only against COVID-19, but also the annual flu vaccination, which we generally give in September or October.
Okay. Lastly, to sum it up, sir, any tips regarding coping up with asthma?
So I think the patients should identify their triggers. If you have your triggers, identify them, then you will be more clued in when it comes to actually avoiding those triggers. And the patient should have an asthma action plan. Basically, this actually helps the patient managing his own asthma in the most optimal way possible. And it tells the patient when the titration of medication is required, when he needs to probably increase his medication, when he needs to adjust the doses. And patients can also, do the asthma control test. So that's a questionnaire. It's available online, and which basically tells us about, the asthma control over the last 4 weeks. So it tells us about the patient's daytime symptoms, whether they are experiencing any nighttime symptoms, whether they have to use rescue medications, whether it's limiting their day-to-day activities. All that is taken into account, and we can actually clearly stratify our patients as well controlled, partially controlled, or poorly controlled. So I think if patients are more proactive in their own care, that goes a long way as well. Avoiding exposure to any of those risk factors, be it smoking. If you are a smoker, smoking cessation is the way to go. And it's not only for bronchial asthma, it's going to help the patient when it comes to other ailments as well. Pets, again, a lot of people have pets. So pet dander, which are dead skin flakes, can trigger asthma-like symptoms. And when human beings come in contact with them, or when human beings, even the proteins that are found in the saliva and on the urine of these animals can trigger asthma-like symptoms. So necessary precautionary measures have to be taken. The other important thing is that there's an entity known as exercise-induced bronchial asthma. That's, so a lot of people who, they have this question that, can I exercise? I am an asthmatic, can I exercise? So exercise is, there's a misconception that if you're an asthmatic, you shouldn't exercise. But that's not the case. The important case is that you prepare yourself prior to the exercise and you understand the environment in which you're doing the exercise. So a good warm-up, like about a 6 to 10 minute warm-up prior to exercise, will help. You should keep your rescue medications handy. You can take the rescue medication prior to the exercise. And generally this happens when you inhale the cold and dry air, which irritates the airways and can trigger asthma-like symptoms. But generally, if you take the necessary precautions, there should be no limitation when it comes to exercise. And, I think the individual should also pace himself directly. If someone is trying to run, you should not try to run 10 kilometers at a stretch. Pace yourself and take your time and assess yourself. So that is an important thing. The other thing would be, it could be like in occupational asthma also. There could be certain sensitizers and triggering factors. So if the person can minimize his or her occupational exposure, that will also go a long way. And generally one would notice this when they are away from work. The symptoms sort of subside, and when they are at work, they sort of flare up. So, this is an important part as well. Then coming to the medications, I think a lot of people have this misconception regarding, inhaled corticosteroids. But, inhaled corticosteroids are the go-to drug for bronchial asthma. So, they come with, if you are really worried about any side effects, they have very minimal side effects. You can have some hoarseness of voice, for which we generally suggest our patients to rinse their mouth with water. And, but by and large, they are very well tolerated, and they work wonders for a lot of our patients when it comes to tackling the airway inflammation and also reversing the asthma symptoms. So, I think patients should, when they are stratified based on where they fall, they should be initiated on inhaled corticosteroids along with the other medications, and then tapered accordingly. The other thing of importance is that the adherence to these medications, so that we should be sure that, patients actually adhere to them. It's human nature for people to just stop because they're feeling better in between. But it's important that these patients are reassured and are told that these medications are working and that they should continue to take them, that the inhaler technique is checked, or the rotacap with rotahaler technique is checked during each consultation visit. And, also teaching them about the proper appropriate use of the inhaler with spacer, or the use of rotacap therapy with rotahalers, so that they are more involved in the care. And, close follow-up of these patients, just to be more mindful when it comes to any deterioration of symptoms or not. And, just in this day and age, everyone seems to be everyone wants to go viral, be it social media or everything. But I think when it comes to asthma, one of the cardinal points would be to not go viral, because viral infections are one of the number one triggers. So controlling that, is important, and vaccinations also go a long way. Patients can also monitor themselves. They can do something known as a peak expiratory flow rate, which is a device, which is just a handheld device wherein the patients have to blow in and record their readings in the morning and night, and to look for any variations. And that will tell us in terms of the asthma control, whether it's under pretty good control or requires any tweaking of medication or not. So I think doctors obviously healthcare professionals have a huge role to play, but the patients also have a huge role to play, because a lot of these risk factors and a lot of these triggering factors are actually avoidable. Yeah, so I think if patients have to meet the doctors halfway, and I think it's important for them to realize that bronchial asthma can't be cured, but it can be completely well controlled, and the patient can live almost a completely normal life. In fact, a normal life if it's under good control. So I think that is very, very important. So yeah, with that, I would like to conclude. Thank you.
Thank you.